Scenario: a female was referred by her GP as having chronic calculator cholecystitis. Hello, I am Dr. Eamon, one of the surgical doctors working here. May I confirm your name and age, please? My name is Anna. I am 46 years old. Nice to meet you, Anna. I will be your doctor today. Can I ask you a few questions? That's fine, doctor. How can I help you today? I have belly pain. I am so sorry to hear that. Analyze the main complaint using Socrates: site, onset, course, duration, character, radiation, timing, severity, aggravating and relieving factors, and associated factors. Could you point to the site, please? Yeah, it's all over my stomach. I see. Miss Anna, does it move anywhere? No. When did you first notice that pain? A long time ago, around 9 months. Did it start suddenly or gradually? Gradual. Did it come and go? Yes, it does. Has this changed recently? Yeah, it becomes more frequent. Is there any specific time during the day that the pain increase? Yeah, after the meal. Is there anything that makes this pain stops? Yeah, when I visit the toilet. Is there anything that makes that pain increase? Yes, food. Could you describe that pain for me? Is it colicky, cramping, or stabbing? It's cramping. How badly is this affecting your day-to-day life? I no longer enjoy my food because I know the pain will follow. If you had to rate the pain from 1 to 10, with 10 being the worst pain, you can imagine how you would rate it? Maybe 8. Differential diagnosis. 1. Irritable bowel syndrome. Is the tummy pain relieved by passing stool? Yeah, doc, how did you know? Experience. An experience. Did it increase when you are stressed? Yeah, stress makes it worse. Do you have bloating? Yes, sometimes. 2. Myocardial infarction. Do you have any chest pain? No, doc. Do you have shortness of breath? No. 3. Inflammatory bowel disease. Have you noticed any slime or discharge? No. Any pain in your tummy, especially with bowel opening? No. Do you have any disturbances regarding bowel habits? What do you mean, doctor? I mean, is there any constipation or diarrhea? No. Have you had any of these mouth ulcers, fever, painful red eye, joint or back pain, or skin problems? Ask this question separately. No, luckily not a single one. Good to hear that. 4. Colon cancer. How has your appetite been? It is the same. No change. Have you noticed any unintentional weight loss or general tiredness? No. 5. Gastroenteritis. Have you been abroad recently? What do you mean by abroad? I mean outside the country? No. Do you have the urge to pass stool despite passing a small amount? No. 6. Biliary colic. Does the pain move to your right shoulder? No. Have you noticed that the pain increase with a fatty meal? Yes, it increases with any food, not specifically fatty meals. Have you noticed the yellowish discoloration of your eyes? No. Past medical and surgical history. Did you experience similar symptoms before? No. Do you have any other medical conditions? Yes, I have stones in my gallbladder. Another thing, doctor, I have diabetes too. Do you take any medications? Yes, I take metformin 1 gram twice a day. Have you ever had a surgery? Yes, appendectomy when I was 16. Family history. Is there anyone in your family complaining about the same? No one. I'm aware of social history. Do you mind personal questions? That's fine, doctor. What is your occupation? I am a barista. Who is at home with you? My husband and my daughters. Do you have any difficulty with the stairs? No. Do you smoke? Yes. How many packs per day? 2 packs. Do you drink alcohol? No. Idea, concerns, and expectation. Ice. Before I go any further, could I ask what do you think the cause is? Maybe my gallstones. What are you the most concerned about? These stones. What are you hoping for us to do for you? Fix the pain, systemic review, start from the head to toe to make it easy. Do you have hitaki? No. Is there any chest pain, SOB, or cough? No. Any problems in passing urine? No. Anything else you want to add? No, that's all, doctor. Thank you, Anna. I will discuss this with my senior and get back to you shortly. Discussion. Present your patient? I took a clinical history from this lady Anna, who is referred to us as having chronic calculus cholecystitis. She is complaining of gradual abdominal pain and bloating. Her symptoms are relieved by passing stool and exaggerated by stress and food. She has no jaundice, no symptoms suggestive of IBD. She smokes 1 pack a day, and she has no family history of a similar condition. So my main diagnosis is irritable bowel syndrome. What are your differential diagnoses? Gastroenteritis, IBD, inflammatory bowel disease, biliary colic. How will you investigate your patient? Blood investigations including 1 FBC to estimate hemoglobin and white cell counts. 2. Inflammatory markers. Imaging including 1 abdominal ultrasound, 2 abdominal X-ray, 3 colonoscopy. Lastly, stool analysis. How will you treat this patient? Lifestyle modifications, fiber diet and stress management, antispasmodics, antidepressants. Refer patient to a social worker, most important. Thanks, doctor. You can proceed to the next station.